Like, well, why can't I just calm down? Well, it makes perfect sense I'm feeling this way because I'm feeling the same sensation that I felt when, so really ask yourself that question. How does it make perfect sense that I am feeling this way given what I've been through? How does it make perfect sense? That is where I would begin.
Most of us are told at some point some version of just relax or calm down, like as if it's that simple. As if stress is just a mindset that we can shift by just like taking a deep breath. But in pregnancy, especially, like what if you had a miscarriage or a traumatic birth? Like we talked about in season 1, episode 6 with OBGYN Callie Buckheit. Or you've experienced other chronic stress or trauma. What if your body is still holding on to all of that? In this episode, I'm joined by Parijat Deshpande. She's an author, a therapist, and founder of Ruvel, who breaks down what's really happening in our bodies during high-stress pregnancies and how our bodies can use and deal with stress appropriately. The taboo for this episode is how stress really affects the body, especially during pregnancy, and why that message of just relax is actually harmful, not helpful. If you've heard previous episodes of this podcast, you may know that when I was 29 weeks pregnant with my son, I was hospitalized with preeclampsia and stayed on bed rest for a month to try to get him through as many developmental milestones as I could before he was born and before the risk to my body was too much. I was so stressed that whole time, but I didn't tell anyone that because I just thought I needed to toughen up. Then 4 years later, my friend had a baby who needed care in the NICU. And all of a sudden, when I was standing in her room washing the parts of her breast pump in the sink with this blue dish soap that they stock in the NICU, I got this overwhelming sense of like doom and fear. And I just started sweating and my body was shaking. It was just this action of washing bottles and the smell of breast milk and that blue dish soap that just like transported me through time. And my body freaked out, for lack of a better word. I did not know how to handle stress or anxiety when I was pregnant, and I wish I did. And here I want to give a trigger warning for this episode for listeners who might be sensitive to stories of pregnancy loss. When I got pregnant with my son, I had already lost another pregnancy, and I was constantly worried that I would lose another. So every sensation of wetness or cramps just sent me into a tailspin. And that has very real effects on the body. Parijat and I talk in this episode about why if you've ever been told to just relax during your pregnancy, or you felt ashamed for being anxious or scared, or like, what's that going to do to my baby? This episode will help you understand why that advice doesn't work. Sometimes it can even make things worse. Because stress is not just in our heads. It affects the whole body, especially during pregnancy. And if you've had a hard pregnancy, a loss, a traumatic childbirth, NICU experience, your body may still be carrying that stress, even if you don't feel it all the time, but there is something that we can do about it. I'm Micah Larson, and this is Modern Hysteria, where we reveal the taboo truths of women's brains and bodies so we can take control, heal, and live without shame. Let's get to the episode. Okay, Parijat, I'm so glad you're here to talk about pregnancy brain. I've actually never had a conversation about this, so I feel very honored that I get to talk to the expert.
I love that. I'm so grateful that you were open to this conversation as well.
And we can see in the background the cover of your book on pregnancy brain. So can we just start with, how do you define pregnancy brain? And how do you think that we talk about it in our culture?
Yeah. Well, I think pregnancy brain culturally is often described in kind of a self-disparaging way. Oh, I can't remember anything. I have pregnancy brain. Oh, I can't keep anything in my head. I have pregnancy brain. Oh, I forgot to call you back. Sorry, pregnancy brain, right? And yes, while those experiences are real and they are certainly a part of the changes that happen physiologically with pregnancy, I wanted to take that phrase, and I think I say this even in the introduction of the book, I wanted to turn it on its head and go, can we understand pregnancy brain as changes to our entire body that are supportive of being able to grow this human being inside of us. And I wanted to kind of take that phrase back.
That is a totally different connotation.
Right?
Yes. My experience of pregnancy brain was like, I didn't really take maternity leave after I had my son prematurely. And that's something we have in common. We talked about having a preemie, and I went pretty much right back to work as soon as I could bring him in his car seat to meetings and stuff. Wow, was I not taking in much of the information. And I couldn't remember where I parked my car. And it's crazy looking back, like how much more compassion could we give ourselves if we knew that this was a whole body change? So how did you become so passionate about this particular subject?
I will say I would never have known about this had I not been through it myself. I mean, there was a time in life, I think I was like 8 years old, when somebody asked me what I wanted to do when I grew up. And I said OBGYN specifically, like not just doctor, but OBGYN, because my best friend's dad was an OBGYN. And I just loved hearing about the work that he was doing. It was just so fascinating to me. Life had other plans. And so I kind of came into women's health through a very different path. Schooling is in clinical psychology, and I used to do child and family therapy, used to teach up at UC Berkeley, go Bears. And then it was really Life University that kind of went, actually, let's open your eyes a little bit more. Because I went through personally infertility, multiple losses, a very high risk pregnancy, and an extremely preterm delivery. My son was born at 24 weeks and 5 days.
Micah here with a quick aside. What does it mean to have a 24-week NICU baby? Pregnancy usually lasts between 40 and 41 weeks. A baby born at 24 weeks is extremely premature. That's 16 weeks early. And at this stage, a lot of babies' organs, like the lungs and the brain, are still developing. And the baby's really small, like maybe the size of a corn on the cob, and needs a lot of medical support to thrive. This is really stressful because babies born this early face lots of risks. They often can't breathe on their own. They have trouble eating and staying warm and fighting off infections. And parents have to watch their tiny little baby in the NICU, the neonatal intensive care unit, sometimes for months, and every day can feel like life or death. On top of that, parents are often still dealing with the shock of a sudden birth or complications or their own physical recovery and fear for their baby. They might feel helpless or overwhelmed or just totally unprepared. It's just not what you plan for. It's a lot for anyone to go through, and that kind of stress doesn't just go away. Okay, back to the episode.
And it was going through that whole experience of being the person and recognizing the gaps in the medical care for people like me, gaps in culture and society for people like me who are fighting to just stay pregnant. It was not a given that being pregnant meant you got to bring home your child. And then gaps in the mental health field, which was my original source of education. I think I was like 15-ish weeks pregnant, and I was already on bed rest at home for 10 weeks by that point. And I remember thinking like, gosh, I'm so anxious all the time. And I'm not typically an anxious person. And I'm like, gosh, okay, I know what I could do. This is literally what I've trained for. And I had this moment. I can still picture where I was in my family room, sun coming in through the windows, thinking, well, okay, if I walked into, if I were allowed to, but right, if I'd gotten support from a therapist, somebody like me going through this, what would they say to me? I knew that because I was that person professionally. And now as the mother, I went, oh my gosh, I didn't need any of that. I don't want any of that. What I want to know is, how do I stay pregnant? How do I prevent my anxiety, my fear of losing another child? How do I prevent that from affecting my pregnancy health? And that's kind of where the seed was planted. And when I land in the hospital at 22 weeks and 4 days, and I was 3 centimeters dilated, the doctors were like, you are probably not going to make it more than 72 hours. You need to prepare yourself. You're going to lose this child. And I went, okay, heard. Also, I feel like throughout this pregnancy, I've been doing a lot of body type work that was really focused on kind of the intuitive sense I had about what it meant to support my body through this. Can I try some of this? And now who in their right mind would say no to somebody in my position at that point? So all the doctors and nurses were like, great, sure, do what you need. I consented to all medical treatment too. So I want to be really clear that what I'm saying here is not in addition, it is not in place of medical care. It is in addition to medical care. And despite being on consistent medication, we blew through those 72 hours and I made it 15 extra days, which was just long enough to give my son a chance at life. And in that 15 days, the medication, the medical treatment was consistent. What was not consistent was how often I was doing this body work that I was kind of just following intuitively. And so when I stopped, the contractions picked up and you could see it on the monitor. It was quantitatively visible to everybody. And when I continued it, they stopped all the way up until it was no longer safe for me to be pregnant. My body knew that, and it was time to have the baby. That was the moment. That's when I knew. And so 2 days before he was born, I made that vow to him and me that I literally said it out loud. If we both survive this and we both get to go home and be a family, I'm going to quit my entire career and I'm going to teach people how to do this because it's absolutely ludicrous that I'm having to try to figure it out on my own when it clearly works. And then once, I came out of those 3 years of difficulty post NICU, and discovered there's 70 plus years of data and research and science that explained exactly what I was going through. And that's the premise of Pregnancy Brain.
Okay, I have full body goosebumps right now. And it's so remarkable to me. Like, I so believe in turning pain into purpose. So you really taking that to the next level. And I cannot, just on a personal note, imagine hanging in the balance of 22 weeks and that you've got a while to go before your pregnancy is viable. And I'm so sorry that had to be your experience, even though so much purpose came from it. It's life altering in so many ways. Having a baby at 24 weeks, that's followed by a lot of NICU time. What was happening for you in those 3 years after that made you want to dive into the prescriptive part of this work?
Well, to be honest, for 3 years, I forgot about it because I was so busy with all the cares that come with having a baby born that early and the life that is afterwards. He and I were on lockdown for 2.5 years because we could not risk him getting sick with anything. He would have ended up back in the hospital, probably ventilated again. That was just not a risk we were willing to take. So truthfully, the seed was planted 2 days before he was born and then nothing grew. Or maybe it was growing under the soil and I didn't notice, right? But for those 3 years, I was fully focused on helping him with all of his therapies and appointments. And I mean, that alone was a full-time job, just driving him places and doing all the things. And it wasn't until he was finally cleared to be out of lockdown and finally cleared by all his specialists to go, yeah, I think we could try half-day school 2 days a week kind of a thing and see how he does, And it was being able to have that space to go, remember that thing? Remember that? That's when it sprouted. So I think that I needed those 3 years to kind of go full focused in, as now I'm a technically a first-time parent of a living child. And also this is really, really hard. And then personally, I had neglected my own recovery, honestly. Physical recovery to the extent that I relearned how to walk and regained my strength, sure. But beyond that, I tried to get some support, I tried to get some help, and I just was not finding what I was looking for. Nobody seemed to understand the difference between what it was like to parent a 24-weeker compared to a 36-weeker. And now I'm not saying it's not difficult to have a 36-week or a 32-weeker in the NICU, but there are different challenges. And I discovered then, I think that's when it also hit me, the statistics that they were telling us in the hospital, that he's one of a very tiny percentage of children who did survive, which means that most professionals, most providers in any specialty, both for me and for him, did not know what to do. His pediatrician said, this is the tiniest preemie I've ever worked with because they typically don't survive back then. Right now we have a much higher survival rate, which is fantastic. So there was a lot that was missed for me in those 3 years. And so I think it all kind of came to head 3 years later.
You would need to feel seen in the story of parenting a child who was born so prematurely. My son was born at 34. Even so, like, he was so much bigger than most of the other babies in the NICU. And I also fell into that same pattern of I did not take care of myself at all. At all. Like, I did not care about my own safety because everything was about trying to make milk and colostrum and just like keeping him alive and temperature regulated. Micah here with another aside because I just mentioned colostrum. Colostrum is the first milk that your body makes after giving birth. It's thick and yellowish and like super concentrated with nutrients and immune support that are specifically designed for your baby. People call it liquid gold because it's so packed with everything that your baby's body needs, especially a preemie baby. For a baby born early, some people say colostrum is like medicine. Like, do not waste a drop. It protects them from infections, supports the tiny digestive system, and gives their body the best chance to grow. Like, even a few drops can make a difference. When my son was born and I had a little colostrum, the nurses taught me to actually take like the little last drops. We would put it in a tiny little syringe without a needle and put it in his mouth and actually like the last drop, squeeze it out, put it on a little cotton swab and then swab the inside of his mouth with it. Making colostrum and trying to pump while your baby's in the NICU and maybe you've had physical complications can be really emotional and stressful. And I know I put a lot of pressure on myself to do it, but it's important to know every little bit helps. That's why we make such a big deal about colostrum. Back to the episode. And I really can't begin to understand what that's like at 24 weeks. There's so much stress involved with all these phases of pregnancy, high-risk pregnancy, delivery, premature delivery, but just stress less or like calm down or relax is often the advice that we get.
Yeah.
So many pregnant people hear that, but as you explain in your work, like that's just not how our bodies function. Can you break down, like, why can't we just relax on command? Why is it unhelpful advice? And like, what might be a helpful suggestion?
Yeah. I mean, isn't that the most minimizing thing somebody can say? Just calm down. Just relax. It'll be fine. Okay.
Yeah.
You know, I think culturally, we have equated relaxation with the antithesis of stress. And that is not actually true. I like to think of it like if there's a stress train, the relaxation is the caboose. So relaxation comes after we have completed threat cycles. It is not the way to stress less. It is the after effect of addressing stress. And I think that is where we go wrong. There's not a lot of training on this. Stress is something that is just not addressed effectively, both in medical training as well as mental health training. I think that's why it's so consistent that we tend to hear just stress less, just relax, just calm down, because we think that it's the opposite, and it's not. It's the after effect of. And the example that I reference in the book as well is stress is a physiological chain reaction to a threat. And that means that it's happening in the body outside of conscious awareness. So you're not choosing to be stressed out, right? The feelings of what we can call stress are not a choice. They're happening outside of conscious awareness, outside of thinking, outside of language. So we don't sit here and go, I should feel stress about this. Bam, here I go, right? It's a physiological chain reaction. So that means it starts in one place and then there's cascading effects all throughout the body. And I think that's what I love about the field of psychoneuroimmunology is it reminds us it is all the same. One body, one body.
Micah here with another aside because Parijat used the word psychoneuroimmunology. It's a big word for studying how your brain, your nervous system, and your immune system all work together. And if you're under a lot of stress, like during pregnancy, your brain sends signals through your nervous system that can change how your body works. This can affect things like your hormones and your immune system and how your body handles inflammation. In season 1, episode 5, we talked with holistic therapist Megan Shearer about what inflammation really means when it comes to stress and trauma. So if you haven't heard that one, give it a listen. If you've been through infertility, loss, high-risk pregnancy, your body may be carrying stress, even if you feel okay, and that leftover stress can show up in a successive pregnancy and or affect how you recover postpartum. This is where psychoneuroimmunology matters, because it helps us understand that stress is not just like in your head, it's in your body too, like Parijat says. And that's why body-based healing matters just as much as mental health support, especially for people who have had traumatic or difficult pregnancy experiences. Okay, back to the episode.
And so the example that I gave in the book is about a bear chase, but we can use even a more practical example. You're out for a walk, everything's going great. So we'll call that your baseline. Lovely day, you're having a nice time. And then you step off the curb and you see a car coming a little too fast for your comfort. What happens? Your entire body changes. Your entire body changes. The assessment of the threat happens outside of conscious awareness, outside of language. And what happens is blood flow changes, muscle movement patterns change, your sensory system changes, your digestive system changes, every single body system changes to be in line with the one way that your body has assessed you can survive this. So people at this point go, yeah, that makes a lot of sense. It's like fight or flight. And I say, no, it is not fight or flight, because fight and flight are not the same. If you and I are walking down the same street and you're fine, but I have a broken leg, my body is going to assess immediately, outside of conscious awareness, outside of thought, that I can't run. I can't run from this car. I'm probably going to freeze. I'm probably going to stay very still. Maybe I'll put my hands out. Maybe I'll do something protective. Versus you, who does not have a broken leg, maybe you're, a fantastic runner even, that's your automatic, immediate autopilot response, right? So the reason that matters is because then the blood flow for both of us in our bodies are different. The changes to our cardiovascular system is different. The changes to our respiratory system are different, which means the way we address it has to be different, right? And I know we're going to get to that, but I just wanted to highlight that there. Now, okay, the car came. We handled it the way that our bodies are going to handle it. Thank goodness we're okay. They braked in time. Everything was fine. Now, what happens after, right? We're crossing the street together. And eventually there's a predictable pattern in which we complete that cycle. The threat cycle is activated when our bodies, or when our body saw the threat coming, the car that's coming too fast. That was the activation of that threat cycle. And now we have to come down. I often draw it like a bell-shaped curve. So now we have to come down from that. We don't have to actually do anything. That's the beauty of stress physiology. If our body is appropriately supported, we know how to do this. So what's going to happen after that? Well, we're going to probably look at the driver and go, what were you doing, right? But eventually, we're going to slowly start to notice how hot we are. We're slowly going to start noticing how fast our breathing is, how fast our heart's beating. And then slowly, we're going to engage in social interaction. And we're going to look at each other and go, can you believe that just happened? But it's a very predictable pattern in which everything comes back online and starts working again. We don't have to interfere with that process if our body is adequately supported. Living with chronic or traumatic stress is when we need to get involved. But that stress cycle is predictable for all mammals, every single one, every single time.
Okay, so how does the stress cycle affect us in pregnancy in particular?
Yeah. So the nervous system, so the neuro part of that, the nervous system is the one that identifies a threat. So it is usually through your sensory system. So if we take that car example, it's our vision. Through our peripheral vision, we probably saw something we assessed, right? Outside of conscious awareness, outside of language, that car is coming too fast, right? So the sensory part of our nervous system kickstarts the threat response, the cascading effect of which, especially for pregnancy, we look at the impact on the endocrine system, which is hormones, and the immune system, which in this case often is inflammation. Part of the activation of a threat response is the increase of systemic inflammation. We need that to be able to quickly address any kind of pathogens that we come into a contact with ahead of time without needing extra resources. Your body just kind of goes, okay, we've got these supplies just in case, so that it can quickly clot blood, it can quickly close up wounds, and it can start to address any kind of pathogens that do get through. And that inflammation, or those hormonal changes that come with the assessment of a threat, affect pregnancy if they are sustained for longer than a human body is supposed to sustain them. So that's why if you have a stressful day, that's not going to do anything to your pregnancy. If you have a stressful couple of days, even a couple of weeks, that's not what we're talking about, right? I don't want people to get scared. And I think this is where when advice like, well, just relax, you need to relax more, gets into people's heads, right? And we go, oh no, well, this has been an awful couple of weeks. What have I done to my pregnancy? Nothing. You've done nothing. But if it lasts for a long time, or if you come into pregnancy without completed threat cycles and you're still in that state, then you probably have, and many times you can measure this in blood work, what is going on with your immune system, what is going on with your hormones, what is going on with your digestion or your cardiovascular system or something. That's what we look at in pregnancy. And that's what I've referenced in Pregnancy Brain is there's a lot of data that shows this, that certain inflammatory markers that are elevated in pregnancy impact kind of the length of pregnancy or impact the type of pregnancy complications that you're at risk for. Those are the kinds of things that we see that are important to keep in mind when we're talking about stress from this neuroendoimmune perspective.
And we often talk about stress as like an emotional issue. I was definitely thinking this way when I was in the hospital. And for that whole month, I was on the antepartum unit. I have to calm down. Even if people weren't telling me that, it was like a pressure I was putting on myself because I was like, you're already maxing out your anti-anxiety drugs, which I was feeling guilty about being on at all, being pregnant. But like I'm stressed, my baby's getting all of these stress hormones in my body, and I hadn't done a lot of like trauma therapy work yet. So I was coming into it with a lot of like chronic stress. But you argue, okay, of course, it's not just in our brain. Like this is a whole body experience. Mm-hmm. Why is the shift in our perspective, our understanding so crucial?
Because I think if we keep thinking the way that we used to think, right, that is just an emotional thing, then the advice is wrong and it doesn't hit. And I think what makes me really upset is then there are pregnant people who hear that and then they go, well, great. Now I have a high risk pregnancy and I can't calm down. And now I'm screwing everything up, and they take the blame for it. And I say that but really I was there too. I was that person too. And that makes me so angry that one, the advice you're getting isn't even physiologically accurate. So then two, you're getting the extra blame that doesn't even belong to you, And so I think if we update what we actually know about stress physiology, the advice is going to be far more effective and far more doable with results that you can actually feel immediately. And that's
okay. I love that. That is so empowering. Can we talk a little bit more about what is going on in a pregnant body when we're not completing these cycles of stress? Like you've talked about in your work, when we're under stress, our bodies start to deprioritize systems. Like what does that mean? What does that look like?
Yeah. So when there's a threat response, everybody's body will only prioritize the body systems and movement patterns that are going to get us out of this threatening situation. And by out, I don't necessarily mean running away, right? Sometimes it's fight, sometimes it's flight, sometimes it's freeze. And so we need to be able to let the body systems do what they need to do. And so the changes that happen are necessary to get us out of that situation. Those same changes, if they last for too long, are going to be diagnosed as chronic health issues of some kind. Chronic pain, diabetes, cardiovascular issues, right? Because we can't sustain this for very long. I say this in Pregnancy Brain, but I'll say it again here. The concern is never stress. Stress in and of itself is not a problem. We need to be able to activate that threat cycle to keep ourselves safe. It is never about eliminating stress entirely or that stress response entirely. It is about, can we complete cycles faster and can we have less of them? That's the goal, right? And so in pregnancy, what we are finding is, like I was saying earlier, there's kind of two things. One, as I was saying earlier, is changes to the immune system, changes to the endocrine system are directly related to increasing risk of certain pregnancy complications, preeclampsia, gestational hypertension, gestational diabetes, preterm labor even, and preterm delivery also, among other things. The second thing that's happening is, while we're talking about internal body systems, the other changes that happen are at the neurological level. There are changes to our body movement patterns. There's changes to our sensory system. And so the reason that's important is after pregnancy, If we haven't completed those threat cycles, then what we have sustained is what we call somatic memories. And so it's like one of those, you smell apple pie and you go, oh, remember that time when, and it just kind of takes you back there. The same thing happens, and maybe you even know this from the NICU, right? Is the sounds of the machines, the smell of the hand sanitizer, those kinds of things take us back to those moments. And those somatic memories are not ones that we can address with words.
Micah here again, because I want to explain somatic memories. They're memories that are stored in your body, not just your brain. That means your body can remember something stressful or scary, even if you don't think about it much. For example, if you had a traumatic birth or pregnancy loss, your body may still carry that experience. And like a certain sound or smell or physical feeling, like bleeding or lying in a hospital bed, can bring back the same stress, even if you don't understand consciously why you are reacting that way. Kind of like I was talking about with dish soap at the beginning of this episode. This matters for anyone who's pregnant again after a tough experience. You could feel on edge or anxious and not know why. It's not just in your head, it's your body reacting to an old threat it never really got to recover from. So I think understanding somatic memories helps us be gentler with ourselves and shows why that full body healing, maybe not just talk therapy, can be important after pregnancy or birth trauma. Okay, back to the episode.
We have to actually complete the movement patterns that we couldn't complete. And so for both of us, for example, when we were on hospital bed rest, I don't know how strict your bed rest was. Mine was like I was not allowed to even get up. And so I was stuck in a very rigid way of being in my body. And that stays with you because not moving is not normal.
Micah here with a final aside. This one's about bed rest. Why do some pregnant people need it? Bed rest is when a provider tells someone to spend most or all of their time laying down or sitting still during pregnancy. And it's usually recommended for people who have high risk pregnancies, like when there's concern about baby coming too early or complications that could affect both parent and baby. So the idea is to reduce stress on the body in every way possible, especially the uterus and the cervix, so the baby can stay inside longer. Bed rest can help lower blood pressure, reduce the risk of preterm labor, and can help with problems like bleeding or a weak cervix. Here's the thing. Bed rest is not easy. I know it sounds nice, but it can be really isolating, really boring, sometimes scary. For me, a lot of the time on bed rest, I spent listening to my son on the heart monitor. And you might feel helpless or worry that you're not doing enough. And it gives you a lot of time to think. Okay, that's on bed rest. Back to the episode.
It was necessary, right? And so, we're not talking about should they have never asked me to do this? No, I don't believe that. I do believe everything we did contributed to him being able to survive. But there are things we need to do postpartum then to be able to address this, to complete those threat cycles. Otherwise, they stay stuck in our bodies. And this is what we see is people saying, I'm still traumatized. I haven't gotten over my birth trauma, is because they're trying to handle it up here in their head when it's their bodies that need to complete the actual movement that they couldn't do at the time. This is true for hospital bed rest. It's true even after surgeries. When you're anesthetized, this is a big deal. We do a lot of this work in our communities of if you're going to need a C-section, if you're going to need a surgery, this is what you do afterwards, right? The surgery is necessary. We're not going to say don't do the surgery, but we're going to say this is how you take care of yourself afterwards so it doesn't stick with you going forward.
Totally makes sense. I have an episode on this podcast about inflammation, like chronic stress, inflammation, autoimmune conditions with a holistic therapist who does somatic work. Mm-hmm. And this is calling back so much to that about how stress is a necessary response, inflammation, necessary response in our bodies. But like the duration, like you said, if we are experiencing those things at a high intensity for a long time and our bodies don't have the support they need, that's where problems come up, right?
Yeah.
And can you say more about what it looks like to complete those movements that will help us complete the stress cycle?
Yeah. So I'll tell you that this work is not prescriptive. So anyone that's trying to teach you, these are the 3 ways of, say, completing movement patterns, they're not teaching you the right thing, right? What you have to do is it's very personalized. So I'll give you an example to highlight what it looks like. So I used to work with private clients, and there's a client I'm thinking of who delivered full term, but experienced birth trauma in the process. And that trauma really was from the relationship with the medical providers and not feeling safe around them. And it was her first delivery. So she was not entirely sure of, how do you do this and what's the right way. And she came to work with me like 2 years later after the delivery. But at that time, she recognized my body wanted to birth on all fours. And this was a low risk pregnancy with a low risk delivery. Like that should have been an option for her, given everything that I understood about it and what was going on for her medically. But her providers did not want that. They wanted her to birth on her back. And she said, okay, I guess, as many of us do when we're unsure, we kind of follow who we trust or who we think we should trust and say, okay, sure. So she did that by no fault of her own, right? She was just following what they were saying, trusting that it was the right thing to do. Her body's impulse was to be on all fours. So you can imagine if you're lying on your back and what it might feel like to have your body want to be in a different position and you can't, right? Like they wouldn't let her. And so the impact of that was after delivery, she was having a lot of back and shoulder pain, just chronic achiness. And she went to massage therapy, she went to physical therapy, and nothing was really getting at it, right? And so when she started working with me, what we looked at was, how are you holding your body right now? We noticed that it was rigid. And so then we had to actually teach her how to relearn how to listen to her body's impulses. Now, impulses are just, you don't think about it. It's happening outside of conscious awareness, outside of language. Like if you're sitting on the ground and you notice you change positions, right? It's just more comfortable this way. I'm tired of sitting this way. I move my leg this way. Those are your body's impulses. We have to be able to follow them. In this case, she wasn't allowed to. And so she had trained her body to be stiff and still, hold herself in a way that was contributing to the chronic pain. And then when we started helping her figure out how to follow those impulses, she noticed that there was a movement of wanting to flip over, a movement of wanting to not necessarily even get on all fours, but just move a little bit outside of that stiff pattern that she had been used to so far. She was able to do that. We're able to complete those cycles with her, and the pain disappeared. It's gone.
Like this brings us back to why we need to understand that this is not just a in my brain stress happening. Like this is a whole body experience.
Yeah.
So for a lot of women, especially after having pregnancy complications with their first child, they're preparing for a second pregnancy and they're trying to do everything right. So what do they need to know from your perspective that they may not be hearing at like their prenatal appointments?
Yeah. Those are actually the people that come to us at Ruvel, truthfully, are the ones who've been through it and they go, oh, I didn't think this would happen to me, but now I am this person. I am a lost mom. I am a preemie mom. I am a person who's had a high risk pregnancy. And so we have an entire course on this actually, but when you're prepping for pregnancy after a high risk pregnancy, you want to take a very close look at your medical team and go, what needs to change? Who needs to be replaced? Who needs to be added? What did we miss last time that we can address next time to be proactive and preventative? So that's a big piece of that. And we talk a lot about what questions to ask and how to ask them and all of that. But really, you got to stop and don't just replicate what happened, even though they may have been wonderful. Maybe you keep them, but there might be more people that you need to add to that team. And the second piece before you try to conceive is I strongly recommend addressing these stuck movement patterns, incomplete movement patterns before you try to get pregnant, because those types of things will affect your hormones, your immune system, and all your other body systems that can help you set yourself up for a healthy pregnancy. I don't mean that that's going to cure infertility as somebody who's had IVF children. Like I know that's not how it works, but I also know that the more you can stack in your favor, the easier the experience can become.
Who might be an asset on a care team if you've experienced traumatic pregnancy loss and you're approaching it again?
Yeah, it depends on what happened last time. As long as, you have the financial ability and access to this care, hopefully for a while we'll still retain telehealth. And so I've often recommended to clients, even if you don't have them on your primary care team, as long as you have a specialist, you can reach out. That's a little farther away, but via telehealth, I think that's super important to get their perspective. And make sure that you have specialists for all aspects of your care that you need. So if you need a dietitian, work with a dietitian specifically for high risk pregnancies. If you need, cardiovascular help, work with a perinatal cardiologist or somebody who specializes in that. Those are the kinds of questions you want to ask, right? And then a plug for Ruvel, like we are the ones that are doing stress physiology for pregnancy health, specifically for high risk pregnancies. So I would encourage you to bring us on your team as well.
That is such a helpful point of contact, because how would we know what specialists we need? And so many of us don't even know like what specialists are out there, especially if we're don't come from a medical family.
That's right.
So in your book, Pregnancy Brain, you talk about completing the stress cycle. Can we build into a routine, maybe like completing a stress cycle early in pregnancy, before pregnancy, so that we're set up for success?
Yeah. At the back of the book, there is an appendix with a bunch of different things that you can start with that are really easy. They won't help you complete the entire cycle, but they'll get you started on it. And like I said at the very beginning, right? Once we get that going, our body takes over and we're able, most of the time, unless you're dealing with traumatic stress, your body will know how to complete that cycle. And so it's a great place to start. But what I suggest for anyone that's listening right now, number one, you've got to be really honest with yourself that you are still living with incomplete threat cycles. I think that's where most people get stuck, is you're so used to it that the thermostat has changed that you've forgotten what it feels like to not feel this way. And so take a really honest look, have an honest conversation with yourself, listen to maybe people around you that you trust. Most often what I see is people know, but it's really hard to admit to ourselves. So have that conversation with yourself and say, okay, I didn't do anything wrong, but this is where we are. And so, okay, it's time now to address this. Number two, I would say, is really drill into your head that this is not a mental health issue. This is not an emotional issue. This is not something the thinking is going to get you out of. This is something that happened in your previous pregnancy that's still there because nobody else has known how to help you with this. And so it's not on you. It's not your fault. And now that you know, there's a way forward. And the third thing is really wrap your head around the fact that it is possible to complete threat cycles, even when the future is uncertain and even when the future is scary. I know what that's like. Every private client I've worked with has come because of either previous loss, previous preterm birth, previous pregnancy complication. I describe it like you went into the lion's den last time and the lion was there. And now you want to do that again. There's nothing wrong with that. You should be able to want to try for as many children as you want. So get the support that you need, get that guide or whatever you need to be able to bring you back to that lion's den, but this time prepared.
This is reminding me of a conversation I had with a pelvic floor therapist I was seeing after my hysterectomy. I have had a hypertonic pelvic floor, so like really tense. And she was saying that the body keeps the score. Essentially, like there are chronic or like big T trauma events that cause us to maintain like this level of tension in our bodies. For me, it was a sexual assault and various gendered life experiences that may have led to chronic unconscious tension in my body. I had no idea that I was carrying. And you're saying also when it comes to pregnancy, like our body remembers loss, traumatic childbirth, high risk pregnancy, like the stress of that. What other life events might contribute to being unable to complete these stress cycles and like holding it in our bodies?
Absolutely anything. Absolutely anything. There's nothing that qualifies as traumatic enough. It is whatever at that time, we call them shock traumas as opposed to developmental traumas, which is like a big event that happened to your body at the time. So delivery can be one, surgery can be one, car accidents can be another, assault can be another. It's anything that happened too much, too fast to your body at any point in life if those threat cycles aren't completed, we're going to carry it with us. And the way that I see it in our work is we'll take loss as an example. Then for every subsequent menstrual cycle, that feeling of wetness is a trigger for people. Even then when they start fertility treatments and they're using those progesterone suppositories and, there's a lot of stuff that's coming out there, that feeling of wetness is another trigger for them, even though it's not the same thing. It's the sensation of. And so what I would say is, the other thing I'll add is we don't have to remember what happened in order for our body to remember. We don't have to remember in our heads in order for our bodies to remember. The sensory system holds all of that. And I think that's why it's so important to address this before pregnancy, because I kind of describe it as somatic memories in a subsequent high-risk pregnancy are the most predictable surprises for people. Like if you understand how this works, you know that they're coming. So if you address them ahead of time, they won't be there for the next pregnancy.
I wish I had known this. When I had a miscarriage in 2018, and then later that year, I got pregnant with my son, and I had a subchorionic hemorrhage. And so I was bleeding a lot. And already there's like the conscious fear of losing successive pregnancies. But then there's also, like you said, like your body remembers. And it was just like probably so unconsciously triggering to have the like bleeding. And I was consciously scared too, like in the emergency room, like please do an ultrasound. But I didn't even think about how that would continue to impact me.
Yeah.
That makes sense.
Yeah. We see that a lot with insomnia as well. People waking up in the middle of the night, and then we kind of track back to what happened in their previous pregnancy and their water broke at 2 a.m. and they're always waking up at 2 a.m. That's not just kind of a mystical connection. It's the physical state that you're in at 2 a.m. typically when you're asleep. If you sleep around the same time every night, whatever you're feeling internally at 2 a.m. is going to trigger you because of what happened before, so it does show up a lot in a lot of different interesting ways.
That's so fascinating. And I can see that we need an outside perspective, an expert to untangle these patterns that seem so baked in for us that we're blind to them. We're blind to them. Okay. If someone is listening right now and feeling completely overwhelmed by like, I'm trying to conceive, I'm pregnant, I would like to be pregnant in the future, about pregnancy stress, like what action items do you recommend?
I would start with a very important question to yourself, which is, how does it make perfect sense that I'm feeling this way? If you really want to take a truly trauma-informed perspective, trauma-informed means it makes sense and we understand why. Take the time to answer that question really, really well, because it also removes the judgment and the shame and the blame of like, well, why can't I just calm down? Well, it makes perfect sense I'm feeling this way because I'm feeling the same sensation that I felt when, that's as an example. So really ask yourself that question. How does it make perfect sense that I am feeling this way given what I've been through? How does it make perfect sense? That is where I would begin.
What a fabulous question. I find so often that when we're able to see the system as a bigger picture in all these different aspects of our health, that we're able to like judge ourselves less. And so much of the harm that we do to ourselves is like this self-judgment and criticism, especially because I think, and I love to hear what you think about this, that in my experience, I had always assumed that my body would be able to like get pregnant and stay pregnant when I wanted it to. And then it didn't. And I was like, okay, well, I'm messed up and broken and like my body is just betraying me. It's so easy to come down in judgment of ourselves.
Yeah, it is, because it's easier to do that than to hold uncertainty or to hold the unknowns or, to blame somebody you feel like you're not supposed to blame. Like, my doctor did everything. They know more than me. I can't blame them. I'll rather blame myself. And that's not true. What we go through is affected by everything and everyone around us too. And it's not you. It makes perfect sense. And I think that's the coolest part I think about this work is when that I can see that light bulb go off for people. They go, that's right. No wonder I'm feeling this way. They don't believe it here. It's like their whole body shifts and goes, whoa. You can see that blame disappear. And then it gives us room to actually do the work because we're not holding ourselves to this impossible standard of, I should just relax and be calm about this and get over it, or whatever it is that we're telling ourselves.
Yeah, that's not very productive.
Yeah.
It's kind of in the same vein of like, I should calm down or just
Yeah.
relax. It's not realistic or helpful.
No.
Can you tell us a little bit about like how does the body and the brain change with pregnancy and after childbirth? What's going on in there? The system overhaul?
Yeah, it's a huge system overhaul because, again, similar to a threat cycle, when we're pregnant, then all body systems change to support the pregnancy. So, we talk about, for example, we're eating for two. We're not actually eating for two. We're eating to replenish what the baby's taking from us, right? We're eating for ourselves because baby's going to take what baby's going to take. And after that, every body system has changed to support a healthy pregnancy as best as possible. And then postpartum, I don't think anyone believes anymore that postpartum is 6 weeks. It's not 6 weeks. We all know this. I don't believe it's even a year. I think it is multiple years. I think it also depends on whether you're lactating or not and how long that is. And I think it's about a year or so after you're done lactating that you slowly start to come back to a new baseline. And I think that is something I wish we talked more about too, is that baseline is, it's shown a lot kind of in the celebrity culture of I bounced back. And it's actually, even if you look the same externally, internally, your body has changed in a lot of different ways. Mineral depletion, nutrient depletion, even cardiovascular changes happen depending on what the circumstances of your birth and your pregnancy were. I see a lot of autoimmune diseases, especially NICU parents, because of the traumatic stress that they are living with that hasn't been addressed effectively. So yeah, there's a lot of changes that happen. And I like to now think of it like different chapters of the same book, not that we're going back to a previous chapter. And I think that might help us to embrace the changes that happen in our bodies every time that we go through fertility treatments or pregnancies, whether we are able to bring those children home or not.
Yes, I think this is another example of how we underestimate the impact of hormones,
Mm-hmm.
sex hormones and stress hormones on our
Yeah.
bodies because they run all different kinds of systems. So postpartum being we're not bouncing back to the same baseline of who we were before. You're
Yeah.
forever altered. So what are some of the new baseline things that you wish that we would talk about when it comes to the way our bodies are altered after
Yeah.
fertility treatment, pregnancy, childbirth?
I wish we gave ourselves more time to let our brains catch up because our brains are changed in a way. If we do have a child that we could bring home, our brains are changed in a way for at least the first year, if not a little bit longer, to keep that child alive. So vision and hearing and everything is changed. Our sensory system changes in order to stay very focused on this little baby and keep that little baby alive in the world that we live in. We thankfully don't live in a world where there are um, animals that are coming towards our children anymore, but there are other similar aspects, right? We drive a car, we put the baby in the car, we get him on the bus, we put him on a bike. There's all these different elements, but the priority is the baby. And that's how our brain and our body changes. Whether you're lactating or not, it doesn't matter. But the whole body changes in order to protect this child. And then as they get a little bit older, our bodies are then shift with them to help them learn how to regulate, we regulate for them so that they learn how to regulate themselves as they get older. And so a lot of our resources, our internal resources, are given to this child, which then makes it make sense again why this early parenting, and that can be 2, 3, 4 years, feels so exhausting. Aside from the sleepless nights, aside from all the work that you do to feed and clothe and bathe the child, physically, our priority is the baby still into early toddlerhood. And yet society pushes us forward and get back to work in 2 weeks and stay focused on this and get back into doing all the whatever that we used to be able to do. There's a push to go there way too fast than what our body physically is capable of, I think, at the time, physiologically so.
Yeah, and that 6 weeks of postpartum is so arbitrary, and it is really a relief for me and my child's 6 to hear like, no, 2, 3, 5 years.
Yes.
What kind of problems does it present for us that we're not treating motherhood and postpartum with the respect it deserves, basically?
Yeah. Yeah, I love that you framed it that way because I think that's exactly it. I think it results in parents, especially primary parents, with a lot of incomplete threat cycles, which leaves us in a state that is not capable of effectively regulating our babies and our toddlers and our children. I think it results in generational health issues. It's going to show up as health issues for us that adds more stress. It affects the way that we can show up as parents, and then it changes the family dynamic. It certainly changes the way that the child is able to learn how to regulate themselves as they get older. And I think that's how we start to get these generational issues passed down. I think it's a huge problem that has a very simple solution that I wish our society would adapt. I think if we could get more support for new parents, I think if we had much more community care, it would not fall on one person. And I think it would be a lot easier to navigate these early parenthood years if we had a society that was far more supportive and systems that were far more supportive.
Absolutely. Our culture of care around motherhood is it's like it's an individual pursuit. When we colloquially refer to pregnancy brain, we're usually talking about like, I walked into a room and I can't remember why I got here, or like, did my entire IQ just like drain out of my brain and into my uterus with my child? So that's just like the tip of the iceberg. Those are like, that's like symptom of like this great big thing we've just been discussing, right?
Yeah. And some of those changes are necessary for pregnancy, and some of them are necessary changes after incomplete threat cycles. Both are true. Absolutely.
Thank you so much for this discussion. I learned so much. And we have one more question for you, which is, what is in your bag?
Yeah. I love that you asked this. Okay, so I don't have a fun purse anymore because like to keep up with the kids, it's, got to be practical and easy to throw on. But okay, so I've got a scarf. Always have a scarf because I'm always cold. Exactly. Got my wallet. I've had this wallet for years. It's just one of those things you just cannot get rid of. I love it so much.
Trusty companion.
Got my EpiPen. That goes everywhere with me. And then I always take a book. I always take a book with me wherever I go. I haven't started reading this one though, but I've heard it's really good.
And you are a hardcover, or not a hardcover, but you are like a book person, not an e-reader person.
I am. I really tried the e-readers, and I can do it sometimes, but no, I prefer the book in my hand. I can, flip through. Got masks, obviously, because who has time to be sick? And this is fun. My hand warmers, because I'm always cold. Yeah.
Thank you so much for being here. Any last words for us?
Yeah. Well, thank you for having me, first of all, Micah. This was lovely. And I hope that your listeners walk away with a sense of hope. That's really the work that we do at Ruvel, is we want you to feel hope. There's a lot of reason to feel hopeless, to feel out of control, to feel like you have no power in the situation. I've been there. I know what that feels like. And there is science that backs up what we do, that there is hope for you to be able to stack the deck in your favor for a healthy pregnancy, and thus healthy, pass on health and wellness and good things to your children as you go forward. So I hope that is what everybody takes away. And if you want to learn more, best place to do that is on our website, ruvel.com, RUVELLE.com. And then links to books and courses and all the things are from there.
Perfect. And that will be linked in the show notes.
Awesome.
Parijat, thank you so much for your time.
Thank you, Micah. I love that. Thank you.
If there is one thing I hope you take away from this episode, it's this. Stress is not just in your head. Your body is doing exactly what it was designed to do in times of threat, even if that threat is a hospital stay or traumatic delivery or just fear of loss. Pregnancy stress affects the brain, the nervous system, our hormones, and immune response. It's not just something that you can think away. That's why advice like just relax does not work, and it can make us feel even worse, because our bodies need real support to complete those stress cycles and feel safe again. And when we get that mind-body connection and how stress affects us, we can take control over our response and prepare for a new pregnancy without carrying old trauma. Advocate for ourselves with our providers without freezing or shutting down, and feel more emotionally present with our partners or children, and grounded in our bodies instead of like spinning out. If you liked this episode, give it a star rating on Spotify or Apple Podcasts, or share it with someone you think would benefit from it, because that helps the right folks find this podcast and get Parijat's book at the link in the show notes. In our next episode, pharmacologist Dr. Cynthia Brown reveals the truth behind some of the most commonly prescribed pills for women and why she devoted her life to protecting patients from drug side effects. Till then, Take care of yourself.